My name is Lisa Coscia. I'm the Senior Research Registry Coordinator at the Transplant Pregnancy Registry International, and I'd like to welcome you to, I think, my fifth Facebook Live presentation. And in this presentation, I'm going to talk about the outcomes of successive pregnancies in kidney transplant recipients. I would like to thank Dr. Swati Rao from the University of Virginia who performed this study for us, and I will be happy to answer any questions at the end of the presentation. I can't look at my Facebook page and the slides at the same time. So just to let you know, and you can always email us or call the Transplant Pregnancy Registry. So I'm going to just give people another few minutes. I just want to let people know that I've been the research coordinator for the registry since 1997. I have a background. I was a kidney pancreas transplant coordinator and worked on a kidney pancreas transplant floor in Philadelphia prior to taking this position. And I really am happy to be able to speak to anybody about pregnancy after transplantation. I'm also going to be recording this and saving it, and I'll post it on the website and post it on both of the Facebook pages that are for transplant patients in pregnancy. So let's just get started. Just as background, pregnancy in kidney transplant recipients is high risk, and we do see a high percentage of people who have hypertension and diabetes even prior to their pregnancy. And during pregnancy, we do see about half of the recipients report having high blood pressure, and about 31% with preeclampsia, diabetes about 8%, and rejection 1%. The rates for hypertension, preeclampsia, and diabetes are much higher than we see in the general population. So it's really important to remember that this is a high-risk category, anyone who's had a transplant in pregnancy. After pregnancy, though, our postpartum rejection rate is very low, and we also see a low percentage of graft loss within 2 years of delivery. Fortunately, these pregnancies are usually successful with about a 75% live birth rate, but usually our patients deliver about a month early, and we have a high rate of cesarean sections at almost 50%. So nevertheless, many women have had several pregnancies post-kidney transplant. The aim of this study was to analyze the maternal, the transplant, and neonatal outcomes for successive pregnancies in kidney transplant recipients. So the data comes from the National Transplantation Pregnancy, the Transplant Pregnancy Registry International, or I'll be referring to it as the TPR. And it's a voluntary pregnancy registry which has been collecting data on parenthood after transplant for over 29 years. So originally we were called the National Transplantation Pregnancy Registry. The registry changed its name when it expanded to include international transplant recipients, which occurred in 2016. The TPR is a division of Gift of Life Institute and is housed at Gift of Life Donor Program in Philadelphia, Pennsylvania. Participants are identified to the TPR either by their healthcare providers or by contacting us directly via our website or by telephone. As most of you have probably spoken to me over the years, or my colleague Carolyn and Faith, we're really happy to speak to anyone who's had a pregnancy. The study is IRB approved, and we have a verbal and written consent form which allows for the long-term follow-up by telephone, interviews with recipients, and for requesting medical records for both parent and child. We're really proud of our long-term follow-up. If we can get a hold of people, we try and call them every 2 years because we really want to know how they're still doing, how their children are doing, and how their transplant's doing as well. And we're hoping in the future to really look at the grandchildren of the recipients we have and just the long-term transplant outcomes. So what does the registry look like? So overall, you can see here that most of the recipients are kidney recipients, almost 1,200. However, we're starting to accrue more liver and heart recipients all the time. That's why I'm always kind of sending messages on Facebook to try and get more people, because we know that this isn't everybody out there who's had a pregnancy. What we do know is that it's a very representative proportion, and we feel like our numbers have stayed the same over time. So it's really important, if you would, to complete our online questionnaire as well. And then either myself or one of the other coordinators will call you back to do a little more detailed follow-up. What you'll notice is the number of outcomes is greater than the number of pregnancies, because patients do have twins and triplets. And also the number of pregnancies is greater than the number of recipients, because like this study, we're going to look at those patients that have more than one pregnancy after their transplant. So the methods, we analyzed all the pregnancies reported to the TPR in kidney recipients. We looked at pre-pregnancy characteristics, immunosuppression, and comorbidities reported during pregnancy. Maternal, transplant, and fetal outcomes were all analyzed, and the categorical variables were compared using a chi-squared and Fisher's exact test with continuous variables that were analyzed using t-test and ANOVA. And two-sided p-value less than 0.05 were considered statistically significant. So what does our group look like? So we analyzed over 1,000 recipients with almost 2,000 pregnancies and 2,073 outcomes. 528, 40% of the recipients had successive pregnancies, with the number of recipients decreasing with the increasing number of pregnancies. As you see, there's not many who have 6 or more pregnancies. And the outcomes in this we'll go over later, but people can have different outcomes as well. This doesn't necessarily mean someone's had 6 live births. So the number of recipients who had a third pregnancy was about 20%, and then a fourth was 7%, and 3% at 4, and 5 and 6 were similar. One recipient had up to 13 pregnancies. So what do the demographics look like in this group? So the large proportion of our registry are Caucasian, and there were greater than 95% and accounted for more than 95% of the women. And similarly, the proportion of living donor transplant also increased as the number of pregnancies increased. So you can see down here, the people who had the greater number of pregnancies did have a living donor compared to a deceased donor. And as expected, the age at conception went up as you had more pregnancies. And interestingly, the number of unplanned pregnancies went down as patients had more pregnancies. So it's really interesting to see that. And that's one of my focuses, is that people know that they can become pregnant anytime after their transplant, and that it's really important to have a planned pregnancy after your transplant, just so all the factors are weighed in and you know what to expect when you're having a pregnancy post-transplant. So this slide is a little busy. It looks at hypertension, preeclampsia, and diabetes in our patients. So as you see, we find a similar high risk of hypertension before and during pregnancy. And for the most part, the hypertension before and during the pregnancies decreased as the number of pregnancies increased. So we saw less hypertension with greater number of pregnancies. Preeclampsia remained high at 25 to 30% in the whole cohort, but remains similar with increasing pregnancies. So even though it went down slightly, it still remained fairly high with the pregnancy number. And diabetes before and during pregnancies are higher than those reported in the general population, but the proportion was not different with the increase in the number of pregnancies. So we do see that some of our transplant recipients do have gestational diabetes, and this is the need for insulin during pregnancy in this group. So these are patients who all needed insulin. And you can see the bars are the different colored bars are the number of pregnancies. So you have the first, second, third, fourth, fifth, and sixth. So what does the immunosuppression look like? So most of the patients are taking tacrolimus, almost half, and the other portion are taking cyclosporin. In this group also is a group of patients who were transplanted prior to cyclosporin and tacrolimus being available and were just on azathioprine and prednisone. So those are patients that were actually transplanted probably in the 1970s to early 80s before we had cyclosporin available, which came out in the mid 80s. And tacrolimus did not get released in the United States until the mid 90s. So really what you're seeing is almost a different era in these different immunosuppressive medications. Now, we know that mycophenolate mofetil, or it's abbreviated here as MPA, is not recommended to take during pregnancy. However, some of these outcomes occurred before we knew about that, because it wasn't until 2008 that we really saw the increase in miscarriages and birth defects after mycophenolate had been on the market for a few years. But it's really important to remember to continue to take all your medications during pregnancy unless you talk to your doctor. And happy to send additional information about immunosuppression during pregnancy to anyone as well. So how does the kidney do with these pregnancies? So the preconception creatinine remains similar with successive pregnancy and range from about 1.1 up to 3. So really, you know, right in what we would consider a normal range, and there was no statistical significance in any of these outcomes when comparing to each other. So during pregnancy, we did see a little bit higher creatinine during the pregnancy. However, it did remain similar across all the different pregnancies. And same with the percentage of rejection during pregnancy. We really do not see a high percentage of rejection, and these could have occurred in any of the settings. And additionally, with graft loss within 2 years of pregnancy, the range was about 4 to 6%, and the risk of graft loss, it did not increase with the increasing number of pregnancies, which is very interesting. So what do the outcomes look like? So overall, live birth percentage was about 75% in the first, second, and third pregnancy, and it decreased slightly with the fourth, fifth, and sixth. I think that, you know, we don't really know why that is, but some of these patients did have exposure to the mycophenolate and might have tried several times to have to conceive before realizing that we needed to take the mycophenolate to discontinue that and maybe start something else. So the decrease in live birth rate increased with the pregnancy number. And for the most part, the stillbirth rate, ectopic, and termination rates remain very low, as you can see here. And these numbers have really been steadfast since the inception of the registry. We also think because it's voluntary, we might have a reporting bias. So, you know, we just have to keep that in mind that this is a voluntary registry. And we don't hear from everyone who's had a pregnancy ever. So what do the neonatal outcomes look like? So as I've mentioned before, um, kidney patients do deliver about a month early. Um, However, the overall birth gestational age did increase slightly from the first to the sixth pregnancy. And also the birth weight increased slightly as well, and that was statistically significant. We do see a high percentage of preterm births, greater than 37 weeks. That has been pretty steady across the years of the registry as well. But you can see um, there were 1,500, over 1,500 live births with a first pregnancy and almost 900 with a second pregnancy. So, overall, patients might have more than one pregnancy after transplant. Additionally, we did not see any statistical significance with the birth defect, even though the overall percentage was higher. It did not break out statistically significant. And as we've seen over the years of the registry, about half of the women end up having a cesarean section. And that's really for a whole host of reasons, whether it's fetal distress or preeclampsia, creatinine might be increasing, just provider preference. That's really been steady with the registry over time as well. So in summary, kidney transplant recipients frequently have more than one pregnancy. Overall, these successive pregnancies are not associated with any adverse maternal, allograft, or newborn outcomes. There seems to be some type of natural selection towards stable pre-pregnancy allograft function and non-transplant associated obstetric complications as the number of pregnancies increases. There are a high rate of unplanned pregnancies, which I'm constantly trying to get the word out there that people really need to talk about contraception post-transplant. So that's very important. And women with stable allograft function and overall good health should not necessarily be discouraged, but appropriately counseled regarding having more than one pregnancy after their transplant. So just to let you know, this is the contact information to reach the registry. We are outside of the office right now, but I do check email, voicemail frequently. So if you leave a message, but really you can email us and I will answer as promptly as I can. I'm happy to talk to anybody on Facebook or if you send your telephone number, I can send you a call. Really just want to make sure that everybody has the most up-to-date information. And I would guess that we would like to redo this. We did this a few years ago for liver recipients as well. I know there's a lot of people that might be curious about that. So now that we're getting more outcomes in liver recipients, we'd like to redo the analysis as we've gotten more outcomes as well. I'd like to thank everyone for their time and participating with us today. And if you do have questions, please feel free to email or call me. And I am going to save this video and share it on the website as well. So if people weren't able to listen live, you will be able to hear it at a later date as well. So with that, I'm just going to check on Facebook. Oh, we have lots of calls. Yay! And so so there's a I don't think I can't share a copy of the slides, but I'm happy to share the abstract. And the statistics are coming from the Transplant Pregnancy Registry International. There were a couple um, questions that I'm looking at, and we're just really happy um, to hear from everybody. And with that, I'm going to end the live portion of this. And I look forward, I usually do these about every 2 months, so I'll try and do a different organ system next time instead of kidney. Thanks again and have a great day, everybody. Bye bye.